Pulmonary fibrosis, also known as interstitial lung disease, it is a progressive pulmonary disease in which majorly the lung tissue becomes scarred or fibrosed. This leads to improper oxygenation, and there is a decreased ability of transfer of oxygen into the blood due to this scarring, and it is a progressive disorder and chronic pulmonary disorder. The types of pulmonary fibrosis. Pulmonary fibrosis, there are many number of variants, but broadly, this may be divided into idiopathic pulmonary fibrosis. Then you have a term called as hypersensitive pneumonitis, sarcoidosis. Then the pulmonary fibrosis due to secondary due to the connective tissue disorders like rheumatoid arthritis, systemic sclerosis, or multi-connective tissue disorders. Then there could be drug-induced pulmonary fibrosis or environment or occupational induced pulmonary fibrosis. There could be radiation induced also. Causative agent as such is very difficult to define, but we can link the cause of pulmonary fibrosis to underlying diseases. The most common, which idiopathic pulmonary fibrosis, but is present. The hypersensitive pneumonitis is mostly caused due to exposure to pigeons or any fungal infections. There are enumerated causative agents of hypersensitive pneumonitis, but most commonly seen is the pigeon exposure, then sarcoidosis, then the fibrosis induced due to the connective tissue disorders. Patients of pulmonary fibrosis mainly present with cough, which is predominantly dry, and shortness of breath. The cough, which I told is dry, is a persistent cough. The patient has a persistent, continuous cough throughout the day. Then shortness of breath, they get fatigued very easily. Then unexplained weight loss. If there is any, we need to look after the muscle pain or joint pains to rule out the causes of or to evaluate the pulmonary fibrosis. Then these people have characteristic fingers like called clubbing. So we need to look after those physical examination. And shortness of breath is also persistent. These people usually desaturate, that is, they have lower oxygen saturation, and the if you check the SpO2 levels, oxygen levels, those are very less than the normal and fall very commonly after little form of exertion. The main risk factors could be age, because IPF or usually the ILD starts after fifth or sixth decade. Then smoking exposure, one that can be linked to causation of the pulmonary fibrosis. Then very rarely you can see genetic factors also. Certain medications can cause pulmonary fibrosis. Then autoimmune disorders, just like I told, that is rheumatoid arthritis, scleroderma, multi-tissue connective disorder. There is no any specific drug which can cure or we can completely treat the pulmonary fibrosis, as it is a progressive disorder. But we can control the rate of progression of this disease by by drugs called antifibrotics. So these drugs usually help progression of the disease. Some conditions of or variants of pulmonary fibrosis, we can give steroids. Those also reduce the progression. Then we need to treat the underlying disease if it is a connective tissue disorder or autoimmune. So adequate treatment or initiation of treatment of the underlying disease can also prevent or we can treat the progression of fibrosis. Then if it's a advanced stage, the patient might require home oxygen therapy also. And other is the pulmonary rehab program, in which the physiotherapist will teach the patient the proper breathing exercises for a individual suffering with pulmonary fibrosis. The end care, or if it's feasible, then the option would be the lung transplant. There are no any specific recommendations or any way to prevent pulmonary fibrosis, but you can avoid smoking, environmental exposure to hazardous elements, secondhand, limit the exposure to secondhand smoke, promptly treating the underlying disease, then managing autoimmune conditions properly so that the disease won't progress. And to evaluate if any offending drugs are in use which cause the lung fibrosis.